This is Todd Ponsky with the Journal of Pediatric Surgery, and today we are in Taormina, Sicily, and we are at the Italian Society of Pediatric Surgery, and with our host, our wonderful host, Carmelo Romero. Carmelo, thank you for having us here.
Hello, hi, I'm very excited. To host tonight is a social dinner of our 48th National Meeting of the Italian Society of Pediatric Surgery with international participation. Thank you very much.
Thank you, and this is actually a very impressive meeting, and it's an honor to be here. And so we're going to take this opportunity to discuss a paper. The title of the paper is Age at Orchiopexy of the Undescended Testicle in the United States, and the first author is Dr. Williams. And we have with us Professor Agostino Piero from Toronto Sick Kids, who's going to briefly talk to us about this paper.
Thank you much, Todd. This has been a great opportunity to read this paper. It's a very interesting one on a subject which is highly debated. When is the most appropriate time to do an orchidopexy in children with undescended testicles? And the American Urological Association released some guidelines that this operation should be done around 1 year of age, but not later than 18 months. The paper has reviewed two major databases in the United States and found out that actually the timing of the surgery of the orchidopexy in children is not really following these guidelines. Right. And 70% of these children actually get the orchidopexy 6 months beyond the suggested ideal time to do the orchidopexy.
And that's 70. 70.
Wow. 70. So the median time is between 4 and 5 years of age.
Wow.
So the debate continues. Is this affecting the fertility later on of these children or not? We don't know.
Okay, so we have another expert here, Professor Prem Puri, who's from Dublin. And Professor Puri has obviously published a lot about this topic. So, Professor Puri, what are your thoughts?
Well, we published a paper in the Lancet several years ago wherein we showed that what matters is not the timing of surgery. It depends whether the patient has unilateral cryptorchism or bilateral cryptorchism, or if their testis is palpable or impalpable. We examined semen in 142 adults who had a orchidopexy between the ages of 7 and 13 years of age. And what we found was that the semen analysis was normal or acceptable in patients who had a unilateral cryptorchism, and also patients who had bilateral palpable testes, palpable in the superficial inguinal pouch, they also had semen which was normal or acceptable. Whereas those patients who had bilateral impalpable testes, the testes were either deep in the abdomen or canalicular, all these patients in our study were azoospermic. So what the future research should be, I think we need to examine semen in patients who have had a bilateral impalpable testes and have had the operation done before the age of 1 year. That's where we should be putting our research emphasis on.
I
Thank
agree.
you.
So let me just see if I got this right. This paper showed that the AUA recommends that you make the diagnosis of an undescended testicle at 6 months of age. You have a year to repair it. So that should be 18 months. It should be fixed. And they found that 70% of United States surgeons go after that point.
Correct.
But Professor Puri's point is maybe that is not always correct, and that patients that had a palpable testicle, that had an orchidopexy at a later age, had completely normal semen. So this is a very interesting paper. It definitely brings to light a very controversial topic that we still don't know the answers to. We hope you enjoy this review, and we'll see you next time.
Thank you.
Is it Age at Orchiopexy? The title is Age at Orchiopexy. No, Age at Orchiopexy in the United States, I think.
Yes.
That's good enough.